Okay, welcome everyone. I'm really glad you could make it. So today we are going to have a writer's workshop. We'll have a session kind of in two parts. We will first cover the work that we've done at Seattle Children's Hospital in this field, and then we will have several chances for you all to practice. So a little bit about myself. My name is Brett Neeson. I am a senior health educator at Seattle Children's Hospital. I also teach in the School of Public Health at University of Washington, and I'm a private consultant on the side. And I kind of do a mix of things. I train teachers to do comprehensive sex education, and I train doctors and nurses in all kinds of continuing ed subjects. And my colleague Sarah is with me. Sarah, you want to introduce yourself?
Yeah, I am Sarah Chang Bocanegra. I am a health education consultant working with Brett at Seattle Children's, and I'm also an upcoming MPH student. So here to join him.
Great. Thank you, Sarah. So let's get started. So we have no conflicts of interest. Also just letting everyone know that we are not members of the transgender or gender diverse communities, but we are allies. We're not the first people to do this work, but we definitely honor those who've strived to implement inclusive language already. And we welcome feedback on all aspects of this presentation, especially if we make an error or misspeak, or you have any suggestions.
Yeah. Okay, awesome.
And just a friendly reminder, if you could mute yourself if you're in our audience. Thank you. We also just want to thank the folks who helped make this project possible. So several folks at the Seattle Children's Gender Clinic, and also people in our team of patient and family education and communications. So by the end of this session, we hope that you will be able to describe the process to increase language inclusive of gender diverse people in patient education. And we hope that you'll be able to apply strategies to improve the inclusiveness of gendered language in patient education. So our agenda is we're going to talk a little bit about some health disparities around transgender and non-binary people with a focus on youth. We'll tell you a little bit about the history of the project, our methods, our results, what we learned, and then what you can do. And we will wrap up the last half hour with our writers workshop. And we do have time at the end for Q&A. But also, if at any time folks want to interrupt, you can unmute, or I'm also monitoring the chat. And Sarah, if you happen to see something in the chat that I missed, just maybe give me a wave. Thanks. So we wanted to start off by just sharing the mission and vision of Seattle Children's Hospital, and particularly how this project fits into it. So I think the key words in our mission and vision are every child, innovative, and compassion. And we think you'll see that this project strives to include every child, is an attempt to be innovative, and is an attempt to have compassion, particularly for young people who have some of the most severe health disparities. So a couple definitions, so we're all on the same page. Transgender is someone whose gender identity is different from the sex they were assigned at birth. So, for example, someone who is transfeminine is assigned male at birth, but they now identify as feminine. You may have also heard the phrase MTF, or male to female. Someone who's transmasculine was assigned female at birth, now identifies as masculine, but also called female to male, or FTM. Someone who is cisgender is someone whose gender identity aligns with the sex they were assigned at birth. So, for example, doctor says this is a female at birth, this person as an adult identifies as female. Someone who's non-binary is someone who would say their gender identity is not entirely male or entirely female. And gender diverse just sort of encompasses behaviors, appearances, and identities that don't go along with what those that are culturally assigned to their birth sex. And when we talk about using inclusive language, what we mean is just like we do universal precautions to prevent infection in hospitals, we also want to reduce harm with folks because we're not always going to know what people's gender identity is if they don't tell us. So inclusive language means that we use terms that include patients and families who are transgender and gender diverse. We don't assume that all people are male, female, or that their sex at birth matches their gender identity. Inclusive language does not include cisgender people. And ideally, it would be used consistently across verbal interactions, signage, written and web content and forms, and also interpretation and translations as much as possible. So we absolutely live in a gendered world. I'm sure we've all heard about gender reveal parties. In fact, they sell earplugs that are geared towards men and women. Apparently bread and hammers have to be gendered. And we all know about Halloween costumes. And also we use gendered language all the time. So here's just some examples. So a little bit about the transgender and gender diverse population. In 2017, the estimate was about 1 million people in the US, or about 0.6%. However, when we look at youth, 1.8% of youth in 2019 identified as transgender, which was a 2 times jump from the previous estimate. And a 2021 study found that 10% of urban US high school youth identified as gender diverse. And when looking at Black, Indigenous, and people of color students, it was found to be even more. And of all LGBTQ plus young people in 2021, they found 26% of those identified as non-binary, and 50% of those also identified as transgender. So it's a small population, but also there's signs that it's growing. Now, here's kind of a little visual quiz. Does anyone know, some of these are particular people and some of them are groups of people from other cultures. If you've got any ideas who any of these might be, you could type those in the chat. Curious if you recognize anyone. So one person said Marsha P. Washington. That's the person in the upper right. She is a transgender person of color who was widely thought to have thrown the first brick at a police protest at the Stonewall riot, and thought to be one of the beginnings of the LGBT pride movement. Joan of Arc is the top row, second from the right. We all know she wore men's armor and fought and presented in a non-traditional gender expression. A couple of the others in the lower right are the first 2 people who had sex change operations. So that was Christine Jorgensen and Alan Hart. Some of the others, Hijras in the upper left, these are transgender people in India, and in the lower left is Toms, or short for tomboy, but they're Thai people who identify as male but were born female. And this is Hatshepsut, who was an Egyptian pharaoh who kind of went in between male and female in the way that she ruled. So we're going to touch on health disparities. And we want to be really clear that when we talk about health disparities, that these are due to transphobia and systemic problems that trans people face, not the fact of their identity. So from many studies, there's a lot of evidence that folks who are transgender and non-binary have poorer health, lower rates of going to the doctor, higher rates of bullying, discrimination, violence, family and peer rejection, and homelessness. And in fact, I remember in Seattle when they did a study of our youth homeless, it was found that around 50% had been kicked out of their homes because they were some form of LGBTQ, lesbian, gay, bisexual, transgender. But higher rates of substance abuse, depression, anxiety, risky sexual behaviors, eating disorders, and suicide and self-harm. And in fact, in 2020, 52% of transgender and non-binary youth, when they were surveyed, said that they had seriously contemplated killing themselves in that year. It was a rather large study of 35,000 young people. And you can see that when we look at BIPOC youth who are transgender and non-binary, roughly a third of those Native youth actually attempted suicide. 21% of Black TGNB youth attempted suicide. So we can see that when you look at race, that these disparities are intersectional. We also know that many transgender people receive poor medical treatment and avoid care. So from major surveys, about a third had at least one negative experience related to being transgender, anything from as minor to having to teach their provider to actually being physically or sexually assaulted by their provider or someone in the office. And 42% of transgender people of color reported higher rates of mistreatment by healthcare providers. And in fact, a little over almost 1 in 4 didn't see a doctor because they feared being mistreated. We also know that when we affirm transgender and non-binary youth, that we can save lives. So youth reported that they had lower rates of attempting suicide when they had their pronouns respected by all people they lived with. In fact, it was half the suicide rate compared to those who didn't. And also when they were able to change their name and gender marker on legal documents. And LGBTQ youth in general had access to spaces, they had lower rates of suicide when they had access to spaces that affirmed their orientation and gender identity. We also know that gender affirming care is under attack. In 2021, Arkansas passed a bill denying gender affirming care for youth. And in fact, 9 other states are considering similar bills. So this puts at least 45,000 transgender youth at risk of losing access to healthcare. These bills often penalize medical providers, and they could also, some of them would also penalize parents if they seek this care. I will also just mention that there are currently protests happening outside of Seattle Children's because of the work done at our gender clinic. However, these protests don't really go together with public opinion. So in a 2015 national survey, after transgender people came out, most people they told were supportive. You can see a large majority of family members, coworkers, and classmates were actually okay once they were told. We're also seeing that the singular they pronoun is becoming more widely accepted, but it's not universal. So the American Dialect Society voted singular they as their word of the decade in 2020. Merriam-Webster in 2019 said that the singular they was its word of the year. And you can see an informal survey, but you know, more than half said that people they're okay with the AP style book allowing singular they, but we still have a sizable majority who is not in favor. So we also collect stories at Seattle Children's from our patients and our families, and I'm going to share a couple of those. So this one showing that family members do appreciate when they see evidence of inclusion. So this parent said, "The rainbow buttons some staff wore were really nice to see. As a queer family and a trans person, it made me feel more confident that we could be open with staff about who we are and trust that we would all be treated respectfully. I particularly liked being asked about my toddler's pronouns. It made me feel more comfortable bringing my daughter here for care. And families also notice when pronouns aren't respected. So one parent shared, the nurse needed more training around gender pronouns for transgender and non-binary patients. When my child corrected the nurse, she was defensive. This left my child feeling uncomfortable. So Sarah is going to talk to us about some of the unique challenges around gender neutral language in Spanish, which is something we're also working on in this project.
Yeah, so I got the chance to get an insight on what the Spanish language is basically doing in terms of gender neutral. So as we know, Spanish is not a it's a gender language, as is many other languages from the Romance tree. Uh, there's this misconception that we're trying to make words like casa, espejo, vaso, carro as something that can be gender neutral. However, the real push has been to make Spanish gender neutral when referring to people or words that refer to people's job titles, like by adding E or X. But note that if you're a Spanish speaker, it's extremely hard to adapt, especially when you speak it. So we can write it, but speaking those words can be kind of tough. Some popular words we have seen in the US, probably some of you have seen Latinx, Latine, and ella. Ella means they. One way I learned a gender neutral way of writing is in Spanish is todos dash as in todas, so male and female. Niños with an at, or like estimado with the parentheses, which is estimada, so the male and the female version. However, they are still binary. Spain, Chile, Argentina, and Mexico are leading the push for a more gender neutral approach by adding the E. So adding the E as a more gender neutral terms. So here's a chart of an example how it would look like. So we have the pronouns in masculine él, in feminine ella, and in neutral ella. And then we can see how it would look like on the rest of them. So some issues and controversy. So ella was actually added into the RAE, which is the Real Academia Española, which oversees the linguistics regularity of the Spanish language. However, it was up there and then they removed it shortly in 2020. So there was a lot of disappointment and anger by LGBTQ plus activists and organizations. So the RAE will reevaluate adding ella. A constant white disagreement about the term Latinx, mostly through social media. A lot of people from Latin America accuse people who don't live in Latin America as trying to anglicize the Spanish language. And in terms of data, about 3% of people who live in the US who are Latino or from Latin American descent use Latinx. And it's also hard to pronounce the X, and the at, in some opinions, say that it might not be inclusive because throughout Latin America, not everybody speaks Spanish. There's a lot of people who speak an indigenous language. We also have Portuguese, we have French. So it's not as inclusive to have that. In terms of translating, it would from English to Spanish and having it be non-binary language, it can be doable if we have the ella, the e at the end. However, since Spanish varies by country, region, culture, etc., it's a work in progress. It's still hard to translate and find a word that's gender neutral or short sentence for mama, papa, abuelos. And not everyone from Latin America has Spanish as their first language, so there could be a lack of inclusivity when translating or adding a non-binary layer.
All right, thank you so much, Sarah. So a little bit about the history of the project. Like I said, we've worked quite extensively with our gender clinic, the staff there. They've also been able to connect us to researchers and parents who have transgender and non-binary kids, as well as young people who are transgender and non-binary. And in fact, they are working on research where they found that nationally, these 3 questions on the left are used in national surveys, but they are actually finding that this option 4 on the right might be the most comprehensive and possibly the best question to get at gender identity. And this language effort is not in a silo. So there are several other hospital-wide ventures. So we have converted some of our restrooms to be all gender. We've also added these pronoun name badge holders, which are for staff. We have also, in our Epic, made sure that fields like chosen name, birth, sex, gender identity, and pronouns have been added. And these get asked when appropriate. And also there's the creation of this transgender and non-conforming card so that youth could fill it out and hand it to their provider as a way, if they were shy to talk about, they could at least communicate, sex at birth and gender identity. So we use the PMAT to review our patient education. And when we were doing this last summer, this handout on pregnancy testing came up, and we started having a conversation about well, this handout, if it says female patients, could be leaving out our patients who are non-binary or trans boys who would still need the pregnancy testing, but it might, they might feel excluded if they were to see that. So what we did is we, reached out to listservs for both HCEA and IHA. We benchmarked our handouts with other children's hospital handouts. We audited our database, and then we had the help of a university intern to help search within documents, because the database did not, it didn't keep track of language within documents. It was only keywords and titles. We also worked to get leadership buy-in and coordinated across several departments. And we got feedback in the form of emails, focus groups, and surveys. So we talked to a lot of clinical departments at the hospital, including urology, cancer, the gender clinic, adolescent medicine, and our Center for Diversity and Health Equity. We talked with our translators, interpreters, and patient navigators. We talked with several different parents, and we also talked with transgender and non-binary youth. So our standard, we iterated several times as we got more and more feedback. We've also started applying that standard language to our patient ed, as well as forms and web content. And we've also shared the final standard with our clinical administrative teams, because we're hoping that this is going to be not just patient education, but all communications across the hospital. So here are just some examples when this is like when our intern was searching within documents, where she found that these were cases where we could possibly make language more inclusive. And we're going to work on trying that out in a bit. So I'm going to go over the feedback we got from different groups. So from the listservs, we heard things like work with the experts in your system, either use body parts or body function in place of gendered terms, to be aware of the differences between a person with vagina and person who can get pregnant. We also were told get family and patient feedback, include intersex people, and to be mindful of the differences between these terms, sex, gender, gender identity, and sex at birth. When we talk to clinical and hospital staff within children's, we've first of all heard widespread support for this effort. We got lots of suggestions for terms. You know, folks said, don't use trans, don't use gender nonconforming, but I will show when we talk to youth, we got a different opinion about that. Add more terms for parents, consider gender neutral terms for breastfeeding, give examples of the standard applied correctly, address translating gender terms, get feedback from a diversity of parents, especially those who don't speak English, and also that whatever is used in EPIC or on forms across the hospital, that we should be consistent. And Sarah, could you tell us what did we hear from our interpreters and translators?
In Spanish, there are gender terms in the articles for all nouns. There is a disagreement between the following groups about gender neutral Spanish: Spain versus Latin and Central America versus those in the US, adult Spanish speakers versus their children who may be bilingual or only know English, recent immigrants versus Spanish speakers who have acculturated in the US. And for recent immigrants and people of strong faith, there may be an opposition to or lack of understanding of gender neutral terms.
Thank you. So when we got feedback from parents, we heard things like that they agreed or strongly agreed that there was a need for inclusive language. They felt that some terms would probably need definitions. They also felt some terms could cause confusion on some procedure handouts. We got the feedback parents may have trouble thinking of their child as a person with a vagina or a person with a penis. We also got the feedback that explaining why we're using these terms could be helpful. And more feedback, this kind of echoes what we heard from our staff, that it should be hospital-wide. So when we talked to the young people, they were some of our last reviewers, so they found that they affirmed that what we were doing, they really appreciated this project. They suggested some new terms. Like I said, that there was some disagreement about what the young people thought was okay versus what some of the adults in the gender clinic thought was okay. The biggest thing was that they just so enjoyed being part of this process, and they thought it was so exciting to see that this work was happening on a systems level. And I thought for 14 and 15-year-olds to understand systems change was pretty cool. And they expressed an interest in participating in work like this in the future. So from all of that, we came up with a standard, and some of the key things I want to point out is that we wanted to look for opportunities to use gender neutral language. We wanted to consider the balance of health literacy, translation, and cultural issues, consult with translators as needed, and also just that this is not a prescription or an exhaustive list. It's a series of suggestions. So I'm going to show you the list that we've come up with some suggested changes, and I've got it broken down into 5 parts. And I just want to see, I've got a question here. It would be great if you maintain a map of all the instances in the system where this is needed, as the language will continue to evolve and you can then update more readily. Maybe you are doing this. Michael, I would love to hear more about that maybe in a moment. So put a pin in that and let's address that in a moment, because I'd love to hear what you mean by a map. So these were terms about, either gender or, sort of group nouns, and some ideas that we came up with. And here are terms related to procedures specific to people who have a vagina or a penis, or around breast milk or breastfeeding. And in a bit, I'm going to give you a link to a Google Doc, which will have all of this in one place. Here were terms that we came up with, especially related to names of family members. And we also got feedback that that there were certain terms that we should really avoid. So things like preferred pronoun or sexual preference. We absolutely got the feedback that, you know, one's gender identity or one's sexual orientation, it's not a choice or a preference, it just is. So the same thing went for preferred or chosen name. The suggestion we got was just name or name you want us to call you, and then separating that from legal name. We also learned about this concept of dead naming. So for example, if someone is named Susie when they're born and Susie transitions and becomes Max, dead naming would be insisting on calling this person Susie, even when Max has told you, I don't use that name anymore. Also, to not use gender reassignment or sex change anymore, but to use gender affirming surgery or transition. And some other terms to avoid: hermaphrodite, gender nonconforming, and any of these forms of transgenders, a transgender or transgendered, but instead to use intersex, gender diverse. But like I mentioned, we had young people tell us that gender nonconforming and genderqueer are identities that young people do tend to use. And these were options for forms that we have come up with. Like I said, these things are shifting and changing, so we are still working on this. We've not finalized this list yet. So here's an example of a revised handout that's about collecting a clean urine sample. And you can see how on the left it says if your child has a vagina, and on the right if your child has a penis. So it's about the anatomy, it's not about what this kid's identity is. So I'm going to summarize what we've learned. I think big lessons or key takeaways are: get feedback from as many sources as you can, as early as you can. Get leadership buy-in, a champion if possible. It's been great that we've had a lot of support all the way up to our CEO. I love this phrase, nothing about us without us. So if you're gonna make changes to language, then, and it's about transgender and non-binary people, make sure that you are asking them, or at least the people who treat them or work with them. Look for ways to lock this in practice. So like I said, standards, policies, procedures, and also training for staff, and coordinate with other inclusion efforts across siloed departments. Make sure to consider language and cultural issues in translation and interpretation, and provide training as needed. We've definitely understood that this is not going to be easy. And in the field of medicine, we want to do no harm. So although we want to consider people's religious and political views, which might be anti-trans, anti-transgender, what we want to do is focus on the folks who suffer the most harm or have the most health disparities. And so that is people who are transgender and non-binary. And also we want to aim for harm reduction. So there might not always be perfect verbiage, but we're going to try our best. Also, we've learned if you make a mistake, apologize briefly and move on, and just try to do better next time. So kind of don't get stuck in the cycle of apology. And also consider use of gender diverse images. You may notice in this presentation, I have been taking from it's an online bank of photos that's maintained by Vice that has non-binary and gender diverse young people. So what we still have to do is get feedback from more diverse English-speaking families, more diverse English-speaking families and also Spanish-speaking families. We'll formally adopt the standard, and then we will use that standard when we edit new and revised patient education. So here are things that you can do. So today you can practice, and that's exactly what we're going to do next. This week, you can review, there's several resources at the end of this presentation. This month, you could talk to coworkers about this presentation, share it with staff and leaders. So on the conference website, either now or soon, there will be a PDF of this slideshow that you could share. You could also audit your health education for opportunities to replace gendered language, create a work plan, talk to transgender and gender diverse youth and adults, find out what supports them, get leadership buy-in, conduct a workshop just like this, link up with others who are doing anti-racist or anti-bias work, because this work is absolutely intersectional. Read up on health disparities, but don't forget resiliencies and strengths. Reinforce with everyone that health disparities are due to transphobia, not being trans or non-binary. And create training for colleagues on this practice, or at least find it online. So here is an example of inclusive language. So I'd like you to take a moment and read the example on the left. And I want you to see some of the strategies that are being used here. So you can use second person language as a way to kind of get around, talking about men or women, or you can use third person, people. And you can also, instead of linking a body part with a gender, you can just talk about the body part. So here is another example. This is about how cancer treatment can affect fertility. So it uses phrases like most children. It uses sperm and egg instead of male female. Talks about families of their own instead of become mothers and fathers, and talks about testes and ovaries instead of gendering those body parts. So what I'm going to do is I'm going to paste into chat a link for a Google Doc, and you will not be able to edit it, but you can view it. And what it does is it will give the examples that I'm about to go through, and it'll allow you on your screen to to do that. But what I'd like to do is give you all about 5 minutes and try to rewrite these examples. And let's see, do I have the ability to put you into groups? It looks like I don't. Okay, so let's just take 5 minutes, and then I will have us come back, and I would be curious to see what your possible rewrites are. Oh, you can do breakouts. If we could get, let's say, breakout rooms that have 4 people.
Are they working on that for you, Brett?
I
check.
don't see any motion now. Let's see.
I'm sorry, Brett. This is Gunnar, your technician. Did you want groups of 4 for the breakouts?
Yes, please.
Will do. Give me just 1 second.
Okay.
there should be breakout rooms.
Okay. And do I click not now if I'm not going into one myself?
Yes, sir.
Okay.
In the breakout rooms, we don't have the main slide.
Oh, you don't. Okay. Were you able to open the Google Doc
Where did you post that? Sorry,
in the chat?
I don't see that in the chat. I just see the Joan of Arcs and things that people wrote.
I'll repost that in the chat. Just 1 second.
Okay.
Once you're in a breakout room, the chat becomes only with the people in the breakout room.
Oh,
I can copy and paste the link from here, but other people would have to leave their breakouts to come back. Okay, it's that's perfect. The Google Doc is there now.
okay. Oh, I think I had only sent it to the Institute.
Oh yeah, I just noticed that as well. I'm sorry. Also, I apologize for the late start of the session. I was not able to start this meeting until the previous one concluded. So I would have liked to help you out a little bit more in the beginning.
It's okay.
I'm gonna pop back to my breakout room.
Okay. Okay, welcome back, folks. You can either unmute yourself or type in chat. What were some examples? Okay, I see. Can you provide the link to the Google Doc? It should be in the chat, but I'll post it again. So what were some substitutions you were able to come up with?
Just saying some children are born with a buried penis.
Yep, that's a great one. How about others?
Babies.
Also babies, yep. How about for that second one?
Teens or people. So just one option for teens is called embryo cryopreservation.
Yep, you could just be teens, could be people who can get pregnant. People born with ovaries. Or what Echo said was just one option is called embryo cryopreservation. How about where it says female 12 years and older?
Females 12 years and older prior to 4 years. People. You could do children, like in the chat.
Right, children.
Or people.
What about have a code word with your mom or dad?
Parents.
Parents.
Caregiver.
Yep. How about vaginal dilation?
So you could just take out woman
Yeah.
and vagina.
Yeah, so sometimes it's a matter of just deleting terms. And how about this last one?
Replace
although-
girls with people.
Yep, people. So here were ones that I came up with, but like it said, there are definitely options. So I think rather than jump in and out of breakout rooms, because I believe we need to wrap up in about 9 minutes. Here is a handout. It's about HIV and specifically about mother to child infection. So feel free to just kind of unmute or type into chat. What are some phrases in here that we could change so that they would be more inclusive of folks who are transgender or non-binary? So HIV can be passed to the baby during pregnancy. What about this phrase, or by breastfeeding through her breast milk?
Can you just say or through breast milk?
Or through breast milk. Kim mentions lactation. Carol says breastfeeding or chest feeding. Iva says nursing or human milk. Okay, you can pass HIV to your baby. And Kim brings up a great point. Lactation is not a low literacy word. And we, in fact, got the feedback from parents that lactation was not widely understood. And that's a case where, you know, you would want to do some testing where if you use these gender neutral terms, check in with your audience and, you know, is that a word that is understood? Because we are definitely aiming for health literacy as well. So some options I came up with, you can do substitutions. You could also switch this so it was second person. So for example, you can pass HIV infection to your baby, feed your child. If you have HIV, you may not know it. You could give your baby HIV during pregnancy or childbirth. And Michael, could you say a little bit more about your comment? Which issue of health literacy?
Well, I really wanted to give you, the two of you open rein on this topic, but effectively, one of the challenges that can happen is that in the efforts that needs to be made to improve inclusivity, that should be made, that is being made by many, to also take the opportunity to make sure that that actually we're not creating health literacy barriers.
Yeah, so something that we have done is we have family advisors that we regularly send our patient education to, and we ask them through survey questions, you know, about anything that is not understandable. And then we take that feedback back to our clinicians and we try to, you know, as always, bridge that gap between what the doctors and nurses think families need to know, and with our team, you know, what we think is going to be the best for health literacy, you know, and also for inclusion. And between all that feedback, we try to come to the, you know, best solution that meets all of those. So we are really trying with this project, like I said, we're still trying to get more feedback from our a more diverse pool of parents, and then also from parents whose first language, who speak a language other than English. So I think that that testing aspect is really important to make sure that if you make any changes, that families are going to understand.
So maybe as a follow-up, Chung has a follow-up question on that there.
So Iva says, for example, some people don't know what a cervix is, so they may not know if they are a person with a cervix. That is a great point. So something that we do in our patient education is we always try to put the simpler term first, and then if there's a complex medical term, we would put that, you know, in a parenthetical phrase. And when we do web content, we have these glossary words, so they're highlighted, and if you click on them, like a definition would pop up. So definitely defining terms whenever they are new or unusual. So here is another handout, and you know, again, we're not looking for you to change everything, but just what are some phrases that you think we could change that would make this one inclusive? Again, feel free to unmute or you can type in chat.
Maybe for the first, you could say when you're expecting a child with a penis, you have an important decision to make before you take them home or before you go home from the hospital.
That's a great suggestion. In chat, I see at birth, the penis has a hood of skin. Andrea says, whether you're expecting a baby or just welcomed your baby. So here's some suggestions. You could just change from baby boy to baby, from new little guy to baby or child or bundle of joy. You could use the phrase babies assigned male at birth, all newborn boys, or all babies born with a penis. Okay, and I see we've got one more minute. So there are some other examples, but I just wanted to see maybe, does anyone have a final question? So you could try some of these examples when you take a look at the slides, but with our minute remaining, any final question?
Brett, if you had a map, if you had a map of all the places in the system, you know, there may be, say, 20,000 documents, or, you know, we're talking about a lot of work in a health system. Then, you know, as language evolves, you might be able to, you know, get back to those spots. It's a very interesting linguistic area because the language actually evolves. And that's part of what we're doing, is we're trying to be sensitive to those needs.
So we've got you know, standards in place that allow us to review things basically either every year or every 3 years, kind of depending on the nature of it. And different teams are responsible for that. So we are, you know, making efforts to kind of install standards within each team so that those things, you know, do get reviewed. And then when the standards would change, we would then update those teams. And then I see Erica has a question about using pregnant person versus person who is pregnant. Has any testing been done on this? We haven't tested that particular phrase. So I couldn't tell you which one would be more understandable. And did your slide showing the storyboard in Epic show the terms you used? I believe so.
I think so.
Yeah.
I have to unfortunately call this session to an end. It's one of the strange things with the virtual meeting. So if people, this session is going to have to end, and we're going to jump into other rooms. Be well. Thank you for bringing this this really important topic. Very good stuff. Be well.
Thank you, everybody. Bye-bye.
Bye-bye.